Thank you all so much for being here with us today. My name is Lauren, and this is Corey. We are the educators here at Iris. So you may have seen us in past webinars or doing training sessions for your teams. We're always out and about working with all of our favorite people. So thank you for taking the time to join us today for this webinar. And just a few housekeeping things before we dive into the content. As always, everybody is on mute, but we do have a question and answer option. So if you go to the bottom of your meeting, in those settings, you should have the option to submit a question in the Q&A box. We will be answering those questions throughout the webinar. We'll have some dedicated time at the end as well. So if anything comes to mind and you want to submit a question, please feel free to do that. If your question is a little bit more specific to your organization or your camera, we may not be able to answer it live. We may instead follow up with you after the session. So if your question doesn't get answered, please rest assured that I will follow up with you after the session to make sure any questions or challenges you have are addressed. Uh, and so again, you can use that Q&A box at any time during the session. And we'll be able to take care of that for you. I see we do have a few people mentioning some audio issues. We did test our audio prior to the session, so I'm not sure if perhaps it's a computer setting that may need to be adjusted. But you know, we're showing our feed is live and audio is working. So I apologize for any challenges you may be having there. Zoom does have a few options for testing your audio and microphones. In the lower left-hand corner, if you hit the little caret next to the microphone, you should be able to test your audio. Someone mentioned they logged out and came back in, and the audio was working for them then. So again, I apologize. We are showing our audio is live, and it seems most of the attendees can hear us. So hopefully you're able to adjust your settings to be able to hear us as well. Last thing I'll say real quick, in terms of housekeeping, we are recording this webinar. So if you're not able to join us for the full session, or you have coworkers or colleagues who wanted to attend and couldn't, this recording will be available in the April newsletter. All of our past webinar recordings are going to be also posted in the Iris webinar playlist on YouTube. So anytime we host a webinar, we send that link in the subsequent newsletters. Those are always available at the YouTube channel on the playlist, and we include the link to that playlist in our newsletters as well. So these are always accessible to you in the future, for you, for your colleagues. If you're ever onboarding new employees, we make these resources available to you going forward. So. All right, that is all the housekeeping. Thanks for bearing with us through that. We're going to go ahead and get started. So, one of the things we wanted to do before diving into the content is just get a sense of the types of cameras that you all are using. So, as you know, we are a vendor inclusive, platform. So many of our clients are working with different camera types. So, just wanted to get a little bit of a sense of what type of camera you are using. So I just launched a poll. We have a few different options. So if you are using one of these camera types, and I do have a slide that we will show you. If you're not sure what your camera is called, you can refer to this slide to get a sense of where you fall in that category. So we'll give just a few moments for you all to answer that poll. Okay, we're going to close the poll here in just a few moments. So if you haven't registered your camera type, please take a moment to do that now. All right, we're going to end the poll in 3, 2, 1. Okay, so it looks like we've got a pretty good mix of different camera types. We absolutely expected that, and we will be speaking to all of these camera types throughout the session. So there are a few things that are applicable regardless of your camera type, and then there are a few things that are going to be very specific. So we're going to start pretty general, and then we're going to narrow it down to some more of those specific opportunities per camera type. So I'm going to turn it over to Corey, and he's going to talk about when you're evaluating your images, what is it that you're looking for?
All right, so anytime you're taking an image, you really need to know what anatomy you are looking for. We always like to say there are three easy questions to always ask every time you take a photo. And if you get a no to any of those, you need to take either an additional photo, like for the handhelds or with the tabletop, we got to take another one, right? We got to replace that other photo that we took to take another one. So the three questions we always want to ask is, do you see all four parts of anatomy? And this isn't just like parts of anatomy. Just remember, a grader can't grade on something they can't see. So if you can't see it, understand the grader can't see it. If we only have what would be called like half of an optic nerve, that means we don't have all the optic nerve. We always need to make sure we are having the complete anatomy visible. So every time you take a photo, I want you to count your anatomy. You see the optic nerve. Do you see the macula? Do you see the superior arcade and the inferior arcade? So those are the four parts that we're always trying to ask and make sure we have a viewable picture for that. Then your second question, is the anatomy in the correct location? It's basically, is it for the right eye, is the optic nerve on the right side? Because if it's on the right side, all our other anatomy should be visible on left of where the optic nerve is. For the left eye, we want it on the left side. Think of 3 o'clock and 9 o'clock. Those are the targets you always want to see it. So if I know I'm taking the right eye, I want to make sure I can see the optic nerve on the right side about 3 o'clock, right around that vicinity. That will make sure if I have nothing else interfering, we'll see all that. So that's the question two. The last question, is it in focus? So every camera could be a tabletop, could be a handheld. Sometimes it can take out of focus images. Could be maybe you were still moving when you pressed the button. Sometimes maybe the patient was moving. Could be just an error with the camera, the device itself, but always assess your images. Some of them you have the ability to pinch and zoom in to your photo to see, and you can check to see if that like optic nerve, it's the one I always use. If it's clear, I know my photo is clear. And if I answer yes to all three, so is the optic nerve in the right spot? Yes or no? Yes. Okay, moving on. Do I clearly see all four parts? Yes. Good. If I say no, I got to take another. If is it in focus? If I can answer yes to all those, I have a great photo and I can move on from there.
All right. So Corey mentioned the four parts of retinal anatomy. We do have them labeled here. One of the jokes we always like to make is it really doesn't matter if you remember the names of the anatomy as long as you know what they look like. So an experienced operator, they may not remember that they're called the superior arcades, but they know that they need those blood vessels right at the top of the photo. Then, of course, we have the inferior arcades. Those are the blood vessels at the bottom of the photo, and those are extending out from the optic nerve, which is over here on the right hand side. And then finally, we have the macula, should be near the center of the photo and should be a little bit of a shadowy figure. And you're going to see some variance, right? The color of the retina may be different from person to person. The branching of the vasculature, the optic nerves may look different. These are not necessarily indications of pathology. The retina is very unique from person to person, just like our fingerprints. And so, just like our eye color, hair color, skin color is different, the anatomy is going to look a little different from person to person, but you're going to be able to pick out these four major parts.
And this is one of the things I want to touch on is just about the arcades. This is where diabetic retinopathy is diagnosed. Now, our arrows are pointing at basically the artery running through it, but it's all those little branching blood vessels. That's what we really need to capture. Like from the superior, it's that is kind of that big artery is that one. It's all about those little ones falling down. Same thing for the inferior. It's all falling up towards the macula. That is kind of that sweet spot. That is where those, I always say that big artery is like a 12-lane highway with 5 cars. Even if you double it, that blood, nothing's going to rupture in that artery. But those little tiny arcades are like 1-lane dirt roads. They can rupture with additional sugars in the blood. And that's where diabetic retinopathy comes from. So that's really, we want to make sure that is the arcades that we're showing, not just that big thick vein. Because again, the likelihood of diabetic retinopathy showing up in that is very slim. where you have a higher probability in those little tiny little blood vessels that are all moving towards the macula. That is where diabetic retinopathy starts from most of the time.
Absolutely. And to Corey's point, that damage is usually very, very mild, very small, very difficult to identify in early stages. And so your interpreting providers really do need a good view. That's why the focus of the image is so important as well. Those blood vessels need to be well defined because the interpreting provider may not feel confident in whether there's pathology present if the image is blurry and those tiny blood vessels are not well defined. So great point, Corey. Thanks for highlighting. It's not just that major highway, it's all of the little branches that are coming out of it as well. All of that counts. And so, like Corey said, we're looking to make sure we can see all four parts of anatomy. If your camera allows you to take, or well, all of the cameras, you can take multiple photos if you need to. If your camera allows you to submit multiple images, you can use that as a means of showing a comprehensive view of anatomy. This is particularly helpful for those handheld and Remedio operators because it's a little more challenging sometimes to get all the anatomy in one image. So, sometimes an exam might be gradable, even though the individual images are not ideal. And so it's really important to know what you're looking for so you can capture what you're missing if that is something that's available to you. If you have a tabletop device, it should be a lot easier to get all that anatomy in one photo. And so sometimes those devices, it's, you're trying to get it in one image.
And the desktops, normally it's going to be a one and done. Handheld, you have more flexibility. As she was saying, you may have three of the four parts. You may have the optic nerve, the superior, and the macula, but you may have something interfering with the inferior. So as for those handheld operators, as your second photo, you're adding an additional photo, but you're going to try to focus and make sure you capture the inferior arcade. I'm not as concerned about having the soup here. I don't need a one and done every time because you can put multiple photos together to complete that anatomy. So important to understand that for handheld operators that you can take more than one photo. Just make sure your other photos are capturing the missing anatomy because again, every grader, we have four parts of anatomy per eye. If you're missing one, the grader can say I don't have enough information. But if you take a second photo of that missing one, you've completed the anatomy for that grader to properly take that.
Absolutely. Absolutely. And so when we're evaluating photos, these are the important things to make sure we're aware of, right? And like Corey mentioned, we also want to make sure that anatomy is in the correct location. And he talked about that optic nerve placement, right? We want it on the left-hand side for the left eye at 9 o'clock. We want it on the right-hand side for the right eye at 3 o'clock. If the optic nerve is in the correct location, that is our guarantee that all the other anatomy is also in the correct location. So this is really important. It's about whether we can see all four parts and whether they're where they're supposed to be. And so, when we're assessing the photos, we want to make sure that we're being very deliberate about assessing that. We're going to talk a little bit later about what causes the anatomy to be in the wrong location, but it is something that we can help address, right? So if you identified that the anatomy is in the wrong place, don't throw your hands up and assume that that patient just has, a bad eye, because it's based on where they're looking, and we can fix that. So.
And just always, again, having that optic nerve, if you notice how the superior and inferior branch out of the optic nerve and the macula is kind of centered, that is what the target is at all times. Now, I kind of talk about the retina is a lot like a globe, it's like where if they look in a slightly different direction, that's going to move the optic nerve, which then can cut off anatomy. And we'll see some of those examples in a bit, but it's very important to make sure you instruct the patient what they need to look for. You may need to give that information before the exam as well as during to make sure the optic nerve's in the ideal spot. Because again, if that's wrong, everything else is going to be in the wrong spot as well.
Absolutely. So one of the things that we always try to do here at Iris is provide resources for you as you are, going out and performing exams, as you are cascading this training to your colleagues. If someone goes on leave and they need refresher, we have resources that are available. And so this is one of the takeaways that we offer. We got a question in the chat about having a picture of the eye and the four parts to have to reference, right? So this is the resource that we would recommend for that. We can send hard copies. We can also send a PDF, so that you can distribute digital copies to your colleagues. So if you would like a copy of the image quality check card, please send us an email. You can contact the support team, or you can email us at iris@retinalscreenings.com. That's the email address. You should have gotten the reminder from the webinar. And again, our support team's information should also be available to you. So please don't hesitate to reach out. We offer this in a postcard and as a poster. So, especially those clients who have like a dedicated room for the exam, some of them will hang this up as a poster. We have clients who are going into patient homes and who are on the move. So, a lot of times they will opt for the postcard. So, again, we're offering this in different ways to accommodate different workflows, but this resource is always available to you if you have a question. All right. And I do want to just reiterate for those of you who have joined us late, this webinar is being recorded. We will be sending a link to the recording out in the April newsletter. It will also be on our YouTube channel going forward. We include a link to that playlist on the newsletter as well. So all of our past webinars are in that playlist, and future webinars will be included as well. All right. So we're going to go ahead and move on. Oh, one more question. So someone asked if they can request both a poster and postcards. That's absolutely an option as well. Yep. So some people do one or the other. Some people like to have a poster and a few of the postcards to disseminate to different users. So um, you should also have a copy of image quality check cards. This would have come to you when you were first going live with Iris. And those cards also have this information. So, in typical fashion, we try to include our information in multiple locations. So, a lot of the organizations we work with have those cards, present with the device or in a central location where operators can access them. All right, so we're going to go ahead and move on to some of the challenges that we see very commonly during these exams. And I just want to preface this by saying our recommendation is always to take the best photos you can and upload them, even if they're not ideal, because there may be pathology present in those images. That being said, there are things that we can really fix pretty consistently. And there are things that are a little bit more challenging where we might be able to mitigate it, we might be able to accommodate it, but we can't always fix it. So we're going to go through those examples kind of in order of things that we can address pretty easily to things that may be a little more challenging to address, but that we can try to mitigate.
We always like to stress that your goal with your camera should be 90% and higher. There's certain desktops you guys can creep up in the 97, 98, but we never expect you to be perfect. We never expect you to capture every image. But a lot of the issues we're going to go over are, as she said, is you can manage those and you can overcome those. Understanding, hey, I didn't get all four parts, but we can overcome those. But as she said, there's some that will be tougher. So we always like to say we don't expect you to be perfect, but we want you to strive to take the best photos possible so we can do the best for our patients.
Absolutely. Absolutely. We have a question. If a patient has issues with one eye, can only one eye be sent? So this is kind of a complex question because it depends on the patient. So in general, absolutely, right? If you upload images of just one eye, that can be interpreted, right? The interpreting provider is going to look at what is sent. And so, that's not a problem if you are, leveraging a human interpreter. Now, if you have AI interpretation, it has to be, there has to be an image of each eye that are uploaded. I don't know if anyone on the call is leveraging that type of interpretation, but for those who have physician interpretation, then yes, you can upload images of one eye. That being said, sometimes I will see operators choose not to upload images of another eye because those images are not ideal, not because they couldn't capture any anatomy. And so this comes back to what Corey and I were just saying. If you're able to capture any anatomy, upload those images, even if they're not ideal. So that would be a case where you might have pretty good images of one eye, Maybe the patient has a condition or some trauma that's making it difficult for you to get ideal images of the other eye, but you were able to capture some anatomy. I would prefer you upload those images and give the interpreting provider the chance to see the anatomy you were able to capture. So, a little bit of a complex question. It does depend. We've got another question regarding a patient being blind. There are a lot of levels of blindness, right? And so, again, I would always advocate for you to try to take photos because any anatomy that you can show is better than none. Diabetic retinopathy causes complete and total blindness. No lights, no shadows, no shapes. So someone who can't see very well, right, they might joke like, oh, I'm blind, but that's not the level of blindness that they will experience if they have diabetic retinopathy that is left untreated. And it also becomes very painful.
Yeah.
So again, like there's a lot of complexity here. At the end of the day, no matter what a patient reports to me, my approach is going to be to try to take photos because if I can capture anatomy, that's what I'm going to try to send.
Just to reiterate, legally blind does not mean totally blind, you know? So legally blind just means they can't see as far as other people. They can still focus on the dot. Now, there are some patients who are definitely, and as she had said, they can still suffer from pathology and diabetic retinopathy can affect their eyesight, which can become painful even though they can't see in it. So we want to try everything because every shot you don't take is you're not helping that patient find it because this is an exam that we are doing. Our goal is once a year, right? Unless they have some type of pathology, then they're going to be doing this multiple times, if not like every month. But we always want to take your shot because every patient that walks out that door that you didn't do, that's a missed opportunity that you could have had done something that is so life-changing. Again, you have a potential of saving someone's eyesight by
Right.
taking this photo. So if you don't take that shot, we've done over 2 million exams at Iris, and we see somewhere between 20 and 25% have pathology. If you just go on the 20%, that's 1 in 5. I bet you all have at least 5 diabetics that show up a day. That means you potentially, just due to math, could potentially save one person's eyesight daily if you were to take a photo every time.
Right.
But every time you let that patient leave, that's an opportunity that you're missing that you could literally save their eyesight, which can make a life-changing event before it
Right.
becomes life-changing.
And I want to be explicit here. We're not saying that you're going to be able to get a good photo every time. We're saying you should make the effort, right? You should
Absolutely.
make an attempt to screen that patient. And if you genuinely cannot get any anatomy and you've done the things that you can do, then that might be a patient that you refer out, right? And that is okay, but we always caution operators against assuming that they can't get something, right? I'm going to try to take the exam. I'm going to do the best I can. And then if I have to refer that patient out, I'm going to make sure that they understand that this is something that they need to do, right? They need to go to an eye care provider and they need to have this exam done because they're at risk of losing their vision, right? Diabetic retinopathy is the leading cause of blindness in the United States among working age adults. This is a very real thing that is impacting people every single day, right? And so again, we just want to ask questions. We want to make an effort. We've got a patient in front of us, right? We've got an opportunity to screen them. Let's take that opportunity and see what we can get. All right, we're going to need to move on. So we're going to talk about some of the things that we run into. I do see a few questions in the chat that I believe will be answered by our continuing on with the content we have. So stay tuned. So the first thing we want to talk about is patient fixation, right? So when the anatomy is in the wrong location, like I talked about earlier, this does not necessarily mean that the patient has pathology or a bad eye. The patient is fixated on a certain point during the exam, and where they're fixated depends on the type of camera that you have. But if your patient is not looking where they are supposed to be looking during the exam, then the anatomy is going to be in the wrong location. And this is often something that we can address and fix based on the camera type that we have, right? So we've got a few different examples from a few different camera types. And so we're going to talk about how you can address this. The very first thing that we say is you got to tell the patient where to look, right? You have got to let them know what their job is. We can't assume that they're going to know where to look. So if you have a desktop, a tabletop, there's going to be an internal light or an X something that they're going to focus on. It's going to be something that they don't necessarily see right away, but as the camera moves into position, it will come into their field of view. And this is true of the handhelds as well, right? There's going to be, for most of those cameras, an internal light that the patient's going to fixate on that they may not see the entire time. And so we want to make it clear to the patient that when they see it, they should focus on it, but they may not see it the entire time. For those tabletop cameras, it's going to be pretty visible directly in front of them. So we want them to stare straight ahead. We want them looking for it. As the camera gets into position, they'll see it. They should focus on it. If you have a handheld device with an internal light, that patient should be covering their other eye. That will help them see that internal light. Usually on those handheld devices, it's a lot smaller. So it's really important that they cover that other eye so that they can see that internal light. And then for those camera operators that have an external fixation point, so some of the Remedio cameras, there's a rod with a dot on it that glows in the dark, right? We want to make sure that that rod is in the correct location, should be horizontal in front of the patient's other eye, so they should not be covering that other eye. And it's really helpful if you shine a flashlight onto the dot before the exam to help illuminate it, right? Because that dot uses glow in the dark, to be able to be visible to that patient. So charging that dot with the flashlight is really helpful. For that external fixation, there's times you need to move it, right? So you may need to move it out along that rod to help that anatomy be in the correct location. And then for some of the handheld devices, you have to change where the light is blinking. So it's important that you make sure you're doing that as part of the exam. If you don't change where the light's blinking and your camera requires that, then that patient's anatomy is not going to be in the correct location.
So I want to also add that if you guys have never had your photo taken, get it taken right away because you need to have that patient experience so you can describe exactly what the patient is looking at. That helps you get the anatomy right. If we look at all four of these images are left eye. You can see the optic nerve in the upper left-hand corner is closer to 12 to 1. Definitely, it's cut off all the anatomy. We don't even see a full optic nerve. We barely see a little, just a small fraction of the inferior, but we see nothing else. Over here on the upper right, again, another left eye, but this is where the fixation is so, they're looking in such a different direction. They're more looking way off towards their ear almost, and it just moves the anatomy. We have a little bit of a superior arcade, but not enough, you know? In the lower left-hand corner, you can see that fixation. That is down there at like a 5 o'clock range. Again, should be at 9 o'clock. How much of that anatomy is there? There is one part of anatomy in that photo, one complete one. There is not enough any of the information we need. Same thing in the lower right. Again, it is almost at that 3 o'clock range. It should be at the 9 o'clock. And we are cut off so much anatomy that that one is a little out of focus, but it definitely, you can see that the anatomy, how much of the anatomy is cut off. And that's kind of that where that fixation, again, you have to see it. If you can get a preview in the infrared, that's one of the stages you want to look for. You want to look for that optic nerve so that you can definitely capture what you need. Because if it's in the right spot in your infrared, your preview, everything else should be there as long as we don't have any interference.
Absolutely.
So.
So when you get these types of photos, right, we need to address them because frequently this is something we can fix. And we're going to go ahead and move on real quick. I do have a question I want to address. Is there a recommended max number of photos per eye? The operator is concerned about the flash harming the eye with multiple photos. You will not harm your patients by taking multiple images. There's not a recommended number of photos because every case is different, right? So you only need one image per eye. If you get all the anatomy, it's clear and in focus and in the correct location. But frequently operators need to take multiple photos. Corey and I perform these exams all the time. We frequently take multiple photos per eye. You're not going to harm the patient. The main thing to remember is that as you are taking photos, that camera flash is impacting the patient's dilation. And so you may need to give the patient a few moments in between images for their eyes to redilate, especially if they already have small pupils. You may consider moving back and forth between eyes. Your patient may report that they see spots. That's normal, right? We are flashing a bright light in their eyes in a darkened room. Those spots will dissipate when you turn the lights back on a few moments after the exam ends. So do not be concerned about taking multiple photos in terms of harming the patient. No harm will come to them by you taking multiple images. It's really more about that dilation. All right. So the next few examples are, again, things that we can address, right? So we're kind of moving from the things that are in our control to things that are a little more out of control. Dirty lens is something that's 100% in our control. Your images should never be not gradable because of a dirty lens, because that is something we can fix. So you're not to be cleaning the lens every time you do an exam. The lenses do not touch the patient, right? We're cleaning the points of contact of the camera that do touch the patient, but the lens should only be cleaned when there is something on it. And you should have dedicated supplies for cleaning the lens. You should not be using an alcohol prep pad to clean the lens. You should be using a lens wipe that is meant for lenses, right? Pretty similar to what we use if you wear glasses. You should be using a dry Kimtech wipe. You should have an air bulb and a flashlight. And so you should know where those supplies are in your clinic so that when you need to clean the lens, you can, but you should not be cleaning the lens every time you perform an exam, only if you see something on it.
You guys should never, a dirty lens should never be a reason you get a non-gradable because that is 100% your fault. That is something that you have total control over to manage this lens. For handhelds, I always suggest Monday and Wednesday morning to check your lens to make sure it's clean. If it's clean, move on with your day. If it needs to be cleaned, clean it, right? For desktops, that lens is a lot of times very, very close to your patient. So I'm going to ask you to, with a flashlight, just shine it at the lens daily. Check it in the right before your first patient. Have somebody check it. If it's clean, move on with your day. If it needs clean, clean it. But we definitely want to have a clean lens every time we take a photo.
Absolutely. And real quick, I want to address this question. If patients have cataracts, glaucoma, macular degeneration, can we still perform the exam? Absolutely, you can. There is no condition that the patient reports to you that would preclude your ability to perform the exam. Some conditions do start to affect the image quality, but this comes back to what Corey and I said earlier. You still want to try to take photos, right? Someone with very early stage cataracts, you can still get good images. So again, if the patient reports something like that to you, it's good knowledge to have, but I would never say don't do the exam because there's not a contraindication and they still need to understand what's going on with their eye health, particularly as it relates to their diabetes. So, we have a few questions regarding dilation drops for certain conditions. That's going to be based on your organization's dilation protocol. So we unfortunately are not going to be able to answer those questions. If your organization uses dilation drops, there is a protocol that they have in place. Some organizations have questions that they want you to ask the patient before you dilate. Most organizations, there's a special order for dilation. Sometimes drop dilation is only to be administered by certain employees. So we are not able to answer specific questions regarding dilation drop protocol because that's going to be specific to your organization. So just want to address that. You're going to be able to find out those questions and answers with your administrators or other trained staff at your locations because that's going to be very specific to your organization. Okay, so we're going to move on to the next examples. These are all kind of related to each other. So we've got some examples of eyelash interference. We have some examples of eyelid interference, pretty related, right? And then we have some examples of complete blinks, right? The patient is their eyes fully closed, right? And so in all of these examples, again, this is something that we typically can address with a little bit of understanding of, explaining the exam and repeating the image capture, right? So first thing to remember, Corey and I don't ever advocate for you to tell the patient not to blink. Because if you tell a patient not to blink during the exam, chances are they're going to start blinking a lot more. The other thing to remember is In all of these camera types, it takes a few moments to capture photos, whether you're using a tabletop and the camera has to get in position, or you're using a handheld device and you're the one getting into position. Your patient can't hold their eye open for 20 or 30 seconds while you get into position. So don't tell them not to blink because it's not helpful, it's not effective, and they can't do it. It's a lot better to time your request to ask the patient to open wide right before the image is captured. So if you're using a tabletop camera, you know that patient's, the camera's positioning, you know when it's getting ready to take that photo. So as that's happening, and some of these devices even have a countdown, right? You're going to wait until it's about to take that photo. You hear it focusing, you know it's about to happen, and then you're going to tell that patient open wide. If you're using a handheld device, as you're getting into position, once you get closer to being ready to take the photo, ask the patient to open wide, right? That's a little more temporary, and we're saving it for when we're actually about to take the photo so they can actually do it for that few moments that we need them to.
And just FYI, just so everybody's aware, the images are inverted. So the top of the eye is the bottom of our photo. That's where eyelid and eyelash interference is going to affect our inferior arcade and can go all the way up, if not higher, depending on how severe it is. Now, you could have somebody with ptosis, a droopy eyelid. One of the things we always prefer you guys to do for, especially you handheld operators, is to sit when you take photos. Because if you're standing, you may be above the person pointing the camera down. If somebody has, a droopy eyelid or fancy eyelashes, that's the first thing you're seeing. That's what's going to affect your image quality. So we want to go to the biggest opening of the eye, and that's why all the desktops they have them set them up in specific areas so that that camera can focus on the largest opening of the eye. So, but these are all overcomable. You can overcome them even if you're in a handheld. You can ask the patient to bridge up that eyebrow, to open that eyelid, and you can come in even if their finger is above and it's like in front of the eye cup. It's okay because we're not blocking the main thing we're looking for, which is the retina. You're not going to get a finger in there. If there's a finger blocking, it's blocking the whole screen. So there's no way their finger's going to get there. So, and even for some of your tabletops, if you have a chin rest and a forehead bar, they can reach around and bridge up that eyebrow. You may want to get a glove and help them, but I always like to ask them because they may be a little more aggressive, and I can say, I need more, you know? So,
Yes, absolutely. The last thing I'll say about eyelid interference, a lot of times we see people blinking more because they're afraid,
mm,
right? So it's really important to be very specific with your patients about what's going to happen during the exam. So I like to tell them, when the camera takes the photo, when I take the photo, you're going to see a flash of light, just like from a regular camera, but there's no pain, no discomfort, no puff of air, right? Let them know like nothing's going to touch their eye. This is not an invasive procedure. They're not going to experience any pain or discomfort, right? And so a lot of times, once we help them understand what's going to happen, that sets them at ease. We want them to blink, right? We want them to feel free to blink normally, but if they're a little bit more relaxed and they have an understanding that like they're not if they're not bracing themselves against a puff of air or something touching their eye, which isn't going to happen, frequently I found that that will help cut down on those that blinking for some of those people.
absolutely.
All right. And this is one of the key reasons that we tell patients we're going to take a few images of each of their eyes because when we run into circumstances like this, we're going to want to take multiple images, right? We're going to need to take another photo and try to time that out so that we're not getting that eyelid interference. Or, like Corey said, we may need to have them help us by pulling up next to their eyebrow to get that eyelid interference out of the way. So, again, you're not doing anything wrong if you're taking multiple photos. Things like this happen. They happen to me and Corey all the time. Sometimes it's just a timing issue, right? With these blinks, sometimes it just works out that way, and so we need to make sure the patient understands, right? Sometimes multiple images are needed. It's just like when you go get an x-ray, right? If they need to take more than one picture of your ankle or your arm, or they're going to do that because they need to show that anatomy to the physician, and we're doing the same thing with this exam.
Yeah, definitely like to never say just one. We're going to take one photo. We're going to take some, keep it broad, keep it like you're not going to be taking 100, but we just want to say, hey, we're not taking one,
Right.
because if you say one and you take two, they're like, why?
Yeah.
You don't want those questions.
Absolutely. Absolutely. So, and then, if you do end up getting everything in the first photo, it's a
Move
happy
on.
surprise.
Yep,
Yep.
moving on.
Absolutely. Okay. So we've talked a lot about things that we can really, typically address pretty well, pretty easily. There are a few things that can be a little bit more challenging to address. So focus is one of those things. It might be us or the camera, or it could be pathology. And so this is one of those things where we need to mitigate it, right? We need to address it as much as we can to ensure that we can't fix what's happened, right? So if there is a focus issue on your images, there are a few things you want to check. If you have a Remedio device, you need to check that external focus wheel and make sure that it is centered. That wheel being centered is a very important aspect of that exam. If you're using a handheld device in general, when you push that button, you need to make sure that you're doing so very steadily, right? If you move the camera during image capture, that can result in a blurry image. If you're using a tabletop camera, your patient may move during image capture. And so it's important to make sure that they're not doing that. It's really important that they are positioned properly so that they don't need to move, that they're not uncomfortable, right? So it could be something on the lens, right? We want to make sure that the focus is not being impeded by artifacts on the lens. So when you get an image that's blurry, it's important that you are doing what you can to address that. I always advocate for taking more images and trying to fix what we can depending on that camera type. If at the end of the day you have taken all the steps that you can and your images are still a little blurry, at that point, we would advocate for uploading the best images that you captured. It could be that there is some kind of pathology that is impeding the focus of the image. But again, we need to make sure that we're doing what we can to mitigate that because frequently it is something related to some sort of movement during the exam or something on the lens.
Just to touch on the Remedio users, if you have one of the newer updates, there is a green circle that spins. You guys might have seen it spinning. That is the autofocus in manual mode. It will focus and take that photo. You'll have to take that photo once it's done spinning. If you take it, it'll sometimes spin early until ignore it till you get to your spot and then park there for a sec, let it refocus, and then take your photo. Make sure you're taking your photo after it completes spinning, not before. And if it's focused before you've gotten to where you want it, your target is, you have to move in and let it refocus. It will reset and focus again. If you take it early, your focal point was farther away than where you're at, and it's going to be out of focus a lot of times. So if you're getting photos out of focus, it could be you're pressing the button too early, or you're just not letting it complete the focus before you're pressing that capture button.
Absolutely. And we're speaking very broadly because this webinar is, touching on a lot of different camera types, but if you have specific questions or if you need to help understanding how your camera operates, please reach out to us. Our support team is available. They can loop me and Corey in on questions that they aren't able to answer. There's a lot of resources here at Iris that are available to you. So again, if we're not able to address something that comes up later, or if you have questions after the webinar and you didn't get to ask them, we're available to you. This is not the only time that you have with us. We are very sincere when we say that we want you to reach out to us. So you can always email us, give the support team a call. Reach out to your contacts here at Iris and get those questions answered so that you can feel more empowered to perform these exams. All right. The last thing we want to talk about, kind of generally, that applies to all the different camera types is dilation. This is one of those things that is a little bit more challenging to mitigate because your patient pupil size is going to vary and it's not something that you can control, right? Your patient's pupil size is what it is. Pupils are like veins. Some people have big ones, some people have small ones, and there are different things that can affect pupil size, but there's no way to know how big someone's pupils are going to be until you try to perform the exam, right? So, one of the things Corey and I always like to talk about is we do not advocate for keeping the patient in the dark for a prolonged period of time before you perform the exam. Most of your patients are going to dilate about as much as they can within a minute or two, right? So sitting them in the dark room for 5 or 10 minutes is not significantly impacting their dilation using natural dilation techniques. So we are really trying to help camera operators cut that out of their workflow so that you can perform the exam a little more quickly. One of the things that's much more beneficial is to take a little bit more time during the exam if your patient has a small pupil. So, once you get that patient in the room where you're going to perform the exam, before you take any action, the best thing to do is to turn the overhead light off. Leave the door open or leave a computer monitor turned on if you're in a clinic setting. If you're doing exams in home, right, making sure that you get in that darkened area as soon as you possibly can so that their eyes can start dilating naturally. At that point, you can explain the exam, clean the equipment. If you're using a tabletop camera, you can make those adjustments using that ambient light in the room. You can have a red night light in the room. All of these things can give you a little bit of ambient light so you're not in the complete darkness. And then you're just going to want to try to perform the exam. Your camera, there's going to be a way to identify how big your patient's pupils are, whether your camera tells you in the millimeter mark, whether you can see the pupil, you're going to be able to get a sense, right, of how big that patient's pupil is. And that's going to tell you what you need to do next, right? So if they have a big pupil, you're going to take the photos and you're going to move on with your day. Easy peasy lemon squeezy. But we know that's not always the case, right? So if they have a smaller pupil, then there's some additional steps you want to take. The Remedio camera has a setting that you can turn on called small pupil mode. So you can activate that setting for that camera. For all of the devices, we recommend giving the patient a little bit of time in between images. You're going to take a photo and then you're going to allow for a delay before you take another photo. Even if you get everything in the right eye, you still want to give a little bit of time before you take the photo of the left eye. And I'm not talking, 5 minutes, I'm talking like 15 seconds, right? Ask the patient how they're doing, check in with them, have a little bit of a conversation, have them close their eyes and rest, let them redilate, right? Because, like we talked about earlier, that flash is not harming them, but it is impacting their dilation. And so we want to make sure that we're giving that time to readjust, to redilate after we introduce that flash.
So whenever you do like the right eye, the left eye, you flash the right eye, the left eye wants to get protective and it's going to shrink the pupil. It's going to make it smaller. We've had some tabletops that measure the pupil. I've seen it drop down 2 millimeters, just by flashing one eye and coming to the other. But then that's why we want that pause to take place because that pupil will be like, okay, right eye just got flashed. It's relaxing and it's getting bigger again and blooming so that you have a bigger view that you can do. Now, again, this is one of the issues that is probably the hardest to handle. We have our own webinar dedicated to dilation, best practices. So this is one that, this is where I would say if you are not going to be successful, this should be the true reason. Not saying all three of these photos, the likelihood of them being gradable is not zero. There's always a chance, and that's if they see pathology. Every one of these eyes has pathology. That means these became gradable. This whole exam became gradable because we saw pathology, the grader saw pathology in the part of the eye they could see. That made this gradable. And then that you basically have a chance of saving that patient's eyesight because now we can get them the help they need to prevent blindness. So very important to always do the best you can, submit the best ones, even if you don't expect them to be perfect or be ideal or be gradable. You guys are ocular photographers. You are taking eye photos. You are not grading the eye. So don't make the assumption that it's not gradable. Just do the best you can. Take the best photos and submit them because like I just said, all three of these have pathology that if you just said, I'm not going to send these, they would never have been found for maybe another year. Or even if they went to, even if you referred them out, doesn't mean they're always going to go. So definitely very important. Always do the best you can. Small pupils are a challenge for anybody, challenge for me and her. There's lots of them that we haven't gotten either. So we don't expect you to be perfect. Just always strive to do the best you can.
Absolutely. So coming back to that workflow with what the dilation, right? We've turned off the light, we've explained the exam, we've cleaned the equipment. At that point, we do want to remove some more of the light. So one of the questions we got is whether the room needs to be completely dark. Again, you can have a red night light. You can leave the door cracked a little bit. If you have a computer monitor turned on, you do want to turn that away from your patients. We want to make sure that the room is as dark as possible. So while it does not need to be completely dark, it does need to be very dark. Your patients also should not be looking at their phones, right? If they get a call or a text during the exam, they should wait until you're done, right? If they look at their phone, then that is the same as you flashing the light from taking the photo, right? That impacts their dilation. So, and some people are more sensitive to light than others. Right. Some people, even turning that computer monitor off can make the difference in a few millimeters, which can make the difference between, an exam that is, has more shadow than one that doesn't. So these are all natural dilation techniques, right? Like Corey mentioned, we have a webinar that's dedicated to best practices on dilation. So we are going to need to move on here in just a moment. That webinar is available on the Iris webinar playlist, as I mentioned earlier, which is linked in every single newsletter that we send out. You can always go to that channel to see our past webinars. And that's a pretty popular topic. So we will do future webinars on that subject as
Awesome.
well. So we did one near the end of last year, which will be accessible on that playlist. And then just coming back to one of the points earlier, there are some clients who are leveraging dilation drops as an option, right? So if natural dilation techniques are failing you and you can't get ideal photos and you have drops as an option, that's the time to use them, right? Try natural dilation techniques first. If it doesn't work, those drops are available to you per your organization's protocols, which again, you do need to consult those to get an understanding of how your organization wants you to handle that when that tool is required. But if you have that tool in your tool belt, it is very helpful. And then again, as Corey mentioned, at the end of the day, anything is better than nothing. All three of these images are examples where the camera operator could not get ideal photos, but the images that they uploaded contained pathology, which was identified. And so the patients got the appropriate referral because the camera operator took the time to perform the exam and uploaded the best images that they could. And Corey and I see this literally all the time. So this is a very common occurrence, and it's one of the reasons that we really advocate for uploading the best images you can, because you never know what they're going to be able to see in those photos that you capture.
Quick tip for anybody who can use dilation drops. If you administer dilation drops one year, make a note in their chart so the next year they come in, you can go grab them and put those dilation drops because their pupils are not going to change yearly. So if you know they have done it, then you can administer the drops while they're in the waiting room, and then they can go see the provider, do everything. When they get back to you, pupils are going to be ready. You're just going to be taking your photos, moving on faster with your day.
Absolutely. All right, we're going to move on to some camera specific stuff. So, we're going to first talk about the tabletop devices. So, in these examples, right, it says camera positioning, but it's really more about patient positioning. I think I forgot to update the verbiage on that slide, but it does say it on this following slide, right? Patient positioning is what you're going to run into with these devices. Your patient needs to have 2 points of contact. They need to have contact with the chin rest and they need to have contact with the forehead bar. The only exception to that is the DRS Plus camera, so the one that's pictured in the center. This particular camera does not have a chin rest, so that point of contact is not relevant. For those patients, they need to wear the forehead rest like a pair of goggles, right? But that is the only camera for which that applies. All the other cameras that we have in the field for tabletop devices have those 2 points of contact, right? That chin rest and that forehead bar. And so it's really important that we are carefully evaluating our patient's positioning so that they are correctly positioned and so that they will not move during the exam. And so we're going to talk a little bit about that. We're going to actually do a quick run through with 3 different camera types just to show you that, right?
So the other thing, again, you have 2 points of contact. You want to make sure their chin is all the way forward and their forehead is touching. If any of those points of contact are not touching, the camera does not like that, and you'll get sometimes white halos. In each three of these photos, you can see some anatomy. That's because it saw part of the pupil, but not the whole target. And it just took that photo. That was, again, all due to patient positioning.
Absolutely. Camera positioning is going to be the factor for these handheld devices. And so, where we are in relation to the patient is going to impact that. So, if we're too far back, if we're out of alignment, if we didn't come in close enough for those handheld cameras, there's also a technique where we kind of tilt the front up and tilt the back down to drive up into the retina. If we neglect to do that right, we can end up with a flash bloom, and so that's blocking our view to anatomy. And then the Remedio cameras, right? Our positioning can impact quality there. If we're out of alignment, if we're too far back, if we're too close, those positioning opportunities can impact our ability to see the anatomy. And so we're going to talk real quick about best practices for all of these devices. We're going to need to go a little quick because we are running up against time. So I do want to make sure that we touch on these points as much as we can. And again, if there's anything we don't address during the webinar, or if you have follow-up questions, don't hesitate to reach out to us.
Just remember, any darkness in your photo is the pupil, 100% the pupil.
All
So
right.
always the pupil.
Absolutely. So we're going to talk about tabletop first. Corey's going to act as my patient. So one of the things I always like to say when you're using a tabletop device, I don't recommend that you stand across from the patient while you're trying to make your positioning updates. You want to come to the side so that you have a really good understanding of whether they're actually making those points of contact. This also helps you evaluate where the camera is in relation to the patient. So I'm going to have Corey sit back for just a second while I highlight one of the most common things that I see. A lot of times camera operators think that because the patient needs to touch their forehead to the bar, that the camera's forehead bar should be across from the patient's forehead. But as you can see, when Corey just got into the camera after I made that adjustment, his forehead is not touching the bar. Now, if I'm standing across from Corey, it looks like his forehead is touching the bar. So I might think he's in the correct position. But if I come around to the side, I can see there's a gap. He is not touching, right? And so as I lower this table, Corey's going to stay positioned, and you're going to see his face comes forward, and now he can make contact with that forehead bar comfortably. We also see his back, right? So when I come to the side, I can see the positioning of that patient's back, whether they're hunched over or whether they're trying to climb up into the chin rest. And so the point that you should be looking at is you want that forehead bar to be about eye level. So if Corey sits back again, we can see this forehead bar is about across from his eyes. It's a little bit lower, so he can come forward and slightly down, and he can push his forehead toward the forehead bar. When I'm training on tabletop devices or doing retraining, this is the most common error I see. The patients trying to climb into the camera because the table is too high. So you always want the table just a little bit lower than you think. And then you can also adjust the height of the chin rest. And so those are the adjustments that we need to make with that. And you want to make sure that patient is comfortably positioned, because if they move during image capture, you're going to end up with some of the images that we just showed you on that example.
And some patients will like to try to hover. They'll try to put all the weight on their forehead and they'll hover. And again, we can manipulate the chin rest. If it's not moving the eye, they are hovering. You need them to rest on the chin rest. Some cameras require that pressure on the chin rest for you to move forward with your exam.
Absolutely.
But others don't. But they all can go up and down.
Yep. And if the patient is in the chin rest and you do need to make those adjustments, please make sure you communicate that to the patient. All right, I'm going to lower the chin rest. I'm going to raise the chin rest. That way they know they're about to go for a little bit of a ride and they're ready to make those adjustments with you. Because like Corey said, especially like if you go down, even if they're making contact, that chin rest, when it starts to go down, they may not go with it. So we want to communicate to the patient as well and make sure that that adjustment is actually effective. It's always helpful to ask the patient if they're comfortable as well, because if they're not comfortable, again, they're more likely to move and we're more likely to get, a bad picture. So we're going to move on to one of the handheld devices. This may not be we're going to do that one first. This may not be the same as the handheld devices that you have, but it's going to be a similar, I don't think, we're not going to demonstrate image capture, so. We don't need to log in. So we're really just going to talk about camera positioning. So for both of these handheld devices, whether it's the Remedio or the handheld, we advocate for you to be seated if at all possible. If you're going into patient homes, you don't need to necessarily be seated. That's going to depend on the environment that you're in. If you're able to, it can help to like kneel down. But the main thing to remember is this camera should be perpendicular to their face, right? So however you can facilitate that. You want to make sure that you've got a good grip of the camera, that is in your dominant hand, and that your finger is always on the image capture button. So for these handheld devices, it's going to be on the front of the camera. You want to make sure that you've got a finger resting on the button. For these devices, it is a two-handed process always, and one of your hands is going to be on your patient. So for the handheld device, you're going to reach out, you're going to touch the patient. If you're holding the camera in your right hand and you're imaging their right eye, you're going to touch on the side of their face, right? If you were holding the camera in your left hand, you would touch the middle of their forehead. And your hand is serving as a bridge to your patient, and it's creating a platform for you to land that camera on. And so your thumb should be out away from their face at eye level so that you're going to be able to land that camera on your thumb and visualize the patient's eyes. So Corey put his whole hand in between my thumb and his face to illustrate the gap, right? Because I want to be able to land that camera on my thumb, and right away I can see Corey's eye in my field of view. I'm set up for success, right? With these handheld devices, you need to be close to your patient. You need your elbows tucked in at your sides. The further you're stretching out, the more likely you are to be activating these muscles and the more likely you are to shake or move or not be comfortable, right? So if you're uncomfortable taking photos, evaluate your positioning. Are you close to the patient? Are you coming in at an angle? Right? To get close to them, to keep your elbow by your side. And then when you land that camera, right, you should be looking at the screen only as you advance the camera closer. And with this device, as you get closer, like I talked about, you want to slightly drop the back and lift the front of the camera up to drive into the light of that retina during image capture. And of course, for this handheld device, Corey would be covering his other eye. When you move to the other eye, keep that camera in your dominant hand, right? And you're going to do that same process. If you're holding it in your right hand, you'll put your left hand on the center of the forehead. If you're holding it in your left hand, you'll put your right hand on the side of their head. If you have the external fixation for the Remedio camera, you will switch hands. So Corey's going to show you image capture with that real quick. We're actually not going to take photos, but he's going to show you that body positioning and the approach, right?
Yep. Same thing. So, Ashley's, we're going to play a little musical chairs. I'll just stay on the left side. Tuck your knees in. Try to, if you're holding in your dominant hand, try to keep your elbows close to your body as possible. The farther out you go, the more muscles you hit. You don't want to hit those. So if I'm doing her left eye, I'm right-handed. I'm going to lightly touch her middle of her forehead. I'm going to land the camera and then just move in towards her eye. And basically, I only have to move about 2 inches. So what I like to do, instead of extending my arm out, I just like to lean in. Just lean into where I need to go. I'm literally leaning 2 inches. It's not a very far away. If you are left-handed, we're going to hold in our left hand, build that bridge just as she had the same thing for the other camera. Thumb level with below the eye level, level with the tip of the nose. When you land the camera, you see everything you need and you're just moving in directly. But we're still coming at that slight angle. We don't want to come straight in. If you're reaching over their knees, that's going to mean you're going to extend farther and get your arms out farther. It's going to be more difficult.
Yep.
Same thing for the opposite eye. We are just flipping sides. Again, if you're right-handed, it's going to be on the temple. For the lefties, it's going to be right in the middle of the forehead, those type of things.
Absolutely. And so again, for these handheld devices, being close to your patient, using both of your hands to advance the camera forward to make those small adjustments. You should always have contact with your patient with your supporting hand. We don't ever advocate for you to put both hands on the camera. You need to know where your patient is, especially in the dark. And then again, you're always looking at that screen, right? You're looking for those visual indicators that the retina is filling the screen, the optic nerves in the correct location. So We do have a webinar directly regarding camera techniques, right? We do a more in-depth demonstration in that webinar as well. So again, these resources are available to you. We will perform additional webinars throughout this year on these various topics. So please join us again. But like I mentioned, in the meantime, don't hesitate to reach out to us. We have a ton of resources available to you, videos, documentation, instruction guides. The Iris U application is available in the portal for you to watch those videos at any time. So this is not, again, not your only means of support from us, just one of the many avenues that we offer to try to help make sure that you have the support that you need. So we are going to go ahead and conclude the session. Again, thank you all so much for joining us. It was an action-packed session, lots of great questions. I really appreciate it. And I apologize, we ran a few minutes over, but if we did not address your question here online, I will be following up with you offline. And again, email us, call us anytime, day or night. We are here to help. If it is nighttime, support will get back to you next business day. But again, thanks so much for your time, everyone. I hope it was helpful for you, and we look forward to seeing you again
Thanks,
soon.
everybody.
Have a great day.
Yep.